this session, I want to speak about the implementation of the XEVMPD. Obviously it follows on from my EudraVigilance thing. There is actually a separate official XEVMPD user training course with a certificate of competence, just to let you know. Now again, I want to give you a brief introduction, some of the more important detail bits, and then some of the challenges as mentioned. But if you've got any questions, it might be wise to keep it to the end, so I could just blast through this. No, it won't take very long, by the way. Anyway, the XEVMPD, or XEVMPD, stands for the Extended EudraVigilance Medicinal Products Dictionary. It is a standardized list of drugs within EudraVigilance, and currently, I've gone here in big, bold letters. It works, it comes under Article 57, Paragraph 2 of Regulation EC 726/2004, as amended. And then, obviously, there's the old Directive 2001/83 EC. They run in parallel with the new regulations until next year. Well, apparently so. Now then, it's due to be replaced at some stage, starting next year maybe, with these international standards. I don't really want to go into that in any fantastic detail. Now then, it's quite straightforward. It's where the MAH are they're mandated to update or required rather to update electronically the information for the AMP. The AMP is the authorized medicinal product. The medicinal product details obviously have to be entered before you do any ISSR processing. It's purely because it's a required field. In other words, you can't send a report if you've nothing, no drug. Okay. Your checklist. Each data element must be in accordance with the XEVMPD data entry rules, and it uses the SMPC. Essentially, it must match the SMPC, but the current SMPC, that is. So each XEVPRM, the product message, must contain details of this product, its pharmacodynamic properties, the MAH, the license and its status, any sort of changes to that, any withdrawals, or if it's applicable. Obviously wants to look at the therapeutic indication or indications. It needs information on the qualitative and quantitative composition, including things like excipients. If it's a combined advanced therapy, then it needs a description of the device. But things like the administratable pharmaceutical form, method of admin, the routes of admin, that sort of thing. Crucially on there, QPPV details, and they have to be current, obviously. And then the very last point is an electronic copy of the latest approved SPC, summary product characteristics, which was used to create the XEVPRM. Its version, the version date is any references, and its language obviously can be in any of the official languages of the EU. So essentially we send the XEVPRMs to the XEVMPD in the way I mentioned before, the gateway method, this automatic E2B method, the EV web trader method, or the EV post method. And that's both for the new and the amended product messages. There are compliance timelines for this, and essentially for these newer, the new product messages, we have to follow a 15-day schedule. For any amendments to product messages already on there, it follows a 30-day schedule for the data authorization. Okay, so why have we been asked to do it? Well, it's really quality, integrity of the information. So it's all, that drug information is consistent for the benefit risk analysis. It's obviously also a case of having everything ready for these forthcoming international standards. Challenges are very similar to ICSRs. There's that user training thing, the scheduling thing. That at least one person per organisation who has undergone official training, that's the EVMPD training, that rule applies, so it's very, very similar. The departmental resources, the trained people, well, that's fairly similar, but it's quite important, really. I've already mentioned my preference to split safety database groups and EudraVigilance group. The reason is that that's a language issue. Now, I can't really emphasize that enough. You see, if anybody comes up against something, a potential issue there, then you must check. Otherwise, I'll check with a suitably qualified person. Otherwise, it can go on forever. The very last point on there is the compliant timelines of the the XEVMPD, I mentioned that the 15 or 30 days schedule, and you have to factor in your training, your official training. Again, if you were going to ask the EMA, if you send a report and it comes out with an error, then again, and you don't know why, then it's again the EMA allowed themselves that 20 days sort of turnaround thing, or maximum 20-day turnaround. So I put a reference to the XEVMPD user training manual, which, as you will, if you follow the link, it's big. Right. So, questions.
You talked about errors. You receive an error message. How frequent does that happen?
It depends. When you submit something, either an ISSR or an XEVPRM, then it's really depending on your data entry. If they don't really understand certain items, certain bits and pieces, then it might be extremely common. It's cases of raise education, really. The report which comes back from EudraVigilance has a code of 1, 2, or 3. 2 is a no-go, and 3 is an absolute no-go. 1 is satisfactory. It shouldn't happen at all, but it does.
Something you mentioned about timelines for the extended dictionary timelines. You said you had 30 days, 15 and 30 days, 15 days after the first authorization and 30 days after any subsequent changes. I'm not quite sure, but did I catch you saying that the EMA have 20 days in which they can, something about the EMA have 20 days in which to do something? I didn't quite catch what.
Yes, sorry. Find that slide in. Right, so if you have an amended message and you submit to the EudraVigilance and you get that error, then, and if you were to go back to them and say, well, what's going on, then they say, well, they give themselves a maximum of 20 days to turn it around.
Okay. But by sending your first message, you've met your requirement of 15 days?
Not necessarily.
No, but if they take longer than 20, if they take 20 days to get back to you,
yes.
How, if they take 20 days, you're out of compliance.
That exactly. So that's one reason you have to, it's with like with ISSRs, you follow all the regulations and guidelines and things. It's the reason I put the the XEVMPD user manual, really. At the end of this particular sort of presentation. That you get this sort of, I'm not sure if you've seen quite a strange message quite often, and you sit there and think, oh, what do I mean by that? And it can, if you don't really realise or don't know or whatever, you could miss what they're actually wanting, and get loads and loads of errors. So, like you say, you can easily be out of compliance. There is actually a document which I have seen at some stage, not sure if it exists now, but it actually gives you the error message and what they're really looking for. So, you think, well, if they're doing it now, then, why didn't give them that in the first place? But it's supposed to know, really.
But the registration team were really helpful anyway.
Okay.
Although it is a pain, but they are very helpful to clarify issues.
Yeah. I think if it also depends if who you speak to, the major the EI rather, to be how helpful they are. It's like if they recognise your name, and for some reason they don't like you, say it, But anyway, yeah. So as I said, if anybody wants any of these slides, by the way, fair enough, just give me a shout. I'll put the reference there, and I'll put a few abbreviations which might be useful. My contact details.